So actually a lot of methods. Our next guest actually opened up her own TCM clinic here in Shanghai. She's from Germany, so let's welcome Doris Rathgeber.
Hi, how are you?
Doris, good to see you again. You brought your friend.
Yes.
Doris Rathgeber is a doctor of traditional Chinese medicine. After graduating as a doctor in TCM, Doris founded a consulting company in China to treat patients with acupuncture and Tui-na massage for physiotherapy, osteopathy, chiropractics, podiatry, nutrition, and psychological consultations.
So who is this guy? How old is he?
Well, he's my acupuncture model. He must be like beginning of Qing Dynasty.
That's very
hopefully.
old.
This one you can already see the meridians and also some acupuncture points on the jaws, on the lower jaw, on the upper jaw. Yeah, that all touches our topic today.
All right, so even so long ago, we were just talking about some TCM methods that were used in ancient times that are still used today. Dr. William knew a lot. Any others that you would recommend?
Actually, in our clinic, we do not see teeth problems. Yeah, very seldom.
Yeah.
But some come to like release their pain. And sometimes they cannot relate their pains to their teeth. That's what we do later. And then we refer them to the dentist.
All right.
So
We
this,
work together.
I see.
so this is how it works.
For example, a patient would come to you with tooth pain or pain in the jaw, and you would examine the patient and then send them to Dr. William?
Right,
Okay.
right. Because traditional Chinese medicine is a whole body approach. So we can, as well as we cannot detach organic systems from other parts of the body, we cannot detach the teeth from the whole system. In traditional Chinese medicine, the teeth start the digestive process. So they are very close related to the stomach and to the intestines. This is why we can relate somehow to the teeth. But if it's not the root of the stomach or the intestines, maybe the root starts from the teeth.
Sure. All right, but you guys collaborate. There's still kind of some
yes.
fusion going on.
Yeah.
Doris, I heard that in TCM you examine the tongue.
Of course.
What are you looking for?
We read about the color of the tongue. We can see if there's internal heat or if there's a deficiency of one of the vital substances, qi or blood. We can see if there is a stagnation of phlegm or heat in the body going on. This is something the tongue shadows.
Okay.
Maybe this is the other way around. Some people go with their tongue problems to see the dentist, and then the dentist will refer to us because it's an internal problem.
Okay.
For example, stomach problem or internal heat from the heart or from the kidney is not strong enough, or the ing, so the cooling element of the kidney is not strong enough, and then, for example, some gum infections might come up.
Most of Chinese, if they suffer from toothache, usually they doesn't consult first is try to see the dentist. Well, try to see traditional doctor for something, because this is something it's big influence from the theory of TCM. And most of Chinese thinking toothache actually is because of firing or heat inside of the body.
Right.
So they want to have something to cooling down. This is the medicine. So Chinese actually, they have, if they have this toothache, they prefer to eat some medicine rather than to see dentists. So this is the difference.
Right. They know that if they see the dentist, it's painful.
Yeah.
So eating some drug is okay, right?
You know, I have been taking my son to the dentist, and they took an X-ray, 360 degrees X-ray, and you saw that all the new teeth were already or are already in his jaw. So a lot of people don't take care of the milk teeth, but then the jaw is already completely inflamed when the new tooth come out, and they are also having cavities then. So there's also something we need the Western and the modern dentistry for. Because we couldn't imagine, even in our age, we didn't know that all the teeth are already prepared in the jaw.
From
Yes,
anything
and
that's
yes,
going on.
exactly. So this is very important. The maintenance starts when the children are very small.
Of course. We actually started talking with Irene about her wisdom teeth. In TCM, is it advised to remove the wisdom teeth?
Well, TCM doesn't advise, but it's the symptom that makes you take them out if it's too severe, and especially the wisdom teeth, if they get inflamed once, they might get inflamed more and more, and it's very close to very important vessels and organs and nerves and so on for the whole head. So it's advised to do it as early as possible.
You guys also mentioned acupuncture, and I heard you're going to do a demo in our studio. Is that
Yes,
true?
right.
Is our volunteer ready? Our brave volunteer? Who's all right? Come on up. And we've also got our TCM doctor, Dr. Catherine from Body and Soul. Come on up.
So where's your pain today?
In lower jaw, the tooth.
Aha, okay. But if you open and close, no problem with your jaw joint.
Yeah.
That's very important as well, because the people they grind their
teeth.
and yes, and have a very close grip because a lot of stress. So this is something we need to work together as well.
And there are methods for treating the teeth grinding.
Acupuncture, physical therapy, all this kind of things. Okay, today it's about the tooth.
Okay. So usually for this case, I'm going to use 2 points on the face and 1 point on the hand. The 2 points on the face, one is the xia guan. Another one is here, is the jiache. Both of the points lying on the meridian of the stomach. So the pain is always about stagnation of the qi in the blood, and in this case, it's because the excessive fire that is causing the stagnation. So manipulation at these two exact point is going to help release the fire from the body, so to soothe the pain.
So if people do not have an acupuncture doctor close by, they can also press it and do massage on it. We put it on her leg so that it's stable. Right, you relax your hand, just keep it like this.
Looks scary.
No, not scary at all. Okay, now she got it.
So no toothache anymore.
Oh,
Still had.
still have.
Okay.
Yeah,
I don't want Doris take away all of our dentist job.
no, it won't happen. All right, do you want to do another one on the side?
Okay.
Yeah?
Okay.
Yeah? All right. Usually we leave it in for about 20 to 30 minutes. And
30 minutes.
yes, and in the meantime we go ahead manipulating.
Okay.
Yeah, just to have the brain setting free more of these happy-making, relaxing, and pain-killing hormones.
All right.
You can see on this hand, it's react by getting a little bit red.
Yeah.
That means she has a good reaction to the needles. And it works. The body is already reacting. Yeah.
Okay.
And then later she will feel that the pain releases, but it takes a while.
Well, thank you for the demo. We're going to take a quick break, so check out our Weixing and Weibo account. And during the break, we also have a street interview about how people take care of their teeth. So let's check it out.